In adult surgical patients across ages, frailty relates to higher postoperative rates of major illness and hospital readmission, and greater healthcare costs, according to New Journal of the American College of Surgeons study findings. Frailty, a decline in function and resistance to short-term stress that typically occurs in old age, is linked to more complications after an operation among adults of all ages, according to researchers of a large new study published as an article in Press on the Journal of the American College of Surgeons website in advance of print. The researchers suggest that a brief measure of frailty can help determine a patient's physical fitness for a non-urgent operation. Among 14,530 adults undergoing various elective operations in a single healthcare system, those who demonstrated 3 or more frailty criteria were significantly more likely in the first postoperative month to experience worse results compared with patients without frailty criteria. Specifically, more frail patients had higher rates of major illness or complications, discharge from the hospital to a rehabilitation facility, readmission to the hospital, or death, researchers reported. Frailty is identified as an important risk factor affecting surgical outcomes in elderly patients and more recently also in younger patients, even people as young as 40, said the study's lead investigator Claire L. Isbell, MD, MSCI, FACS, a general surgeon at Baylor Scott White Memorial Hospital in Temple, Tex. With the national obesity epidemic, comorbidities, co-occurring illnesses, typically seen later in life are increasingly prevalent in younger people. More than half of the patient population studied, 53.9%, was under age 60, she noted. This study is the first to determine the impact of frailty on postoperative outcomes in multiple surgical subspecialties across a large healthcare system for both inpatient and outpatient procedures, said co-investigator Harry T. Papaconstantino, MD, FACS, chairman of the Department of Surgery at Baylor Scott White Memorial Hospital. Nearly 30% of the 14,530 operations studied at Baylor Scott White Health's 4 hospitals were general surgical procedures. Others included urology, plastic surgery, ear-nose-throat, podiatry, cancer, heart and lung, colorectal, transplant, vascular, and oral and maxillofacial procedures. About 68% of the operations were outpatient and 32% were inpatient procedures. 5-point frailty score. To measure frailty preoperatively, the researchers used the modified Johns Hopkins Frailty Score,